Order! Good morning, ladies and gentlemen, and welcome to the House of Parliament for today's debate. For countless years, parliamentary debates have formed the cornerstone of discussion for new ideas and policies. Today we are here to discuss an issue very much pertinent to healthcare management in the 21st century. Emails have already revolutionised communication in many aspects of healthcare, and our motion today is GP email consultations will provide positive outcomes for the NHS. By this we mean an added service from the general practice to deal with compliance inquiries over minor complaints and chronic conditions. Opening government, consisting of Lord Tarver, Lady Aladina and myself, will be speaking for the proposition. And for the opposition, it's Lord Mehmi, Lord Barker and Lady Ho. Each speaker is allocated 2 minutes with 1 minute for the summary. The first and last 30 seconds are protected. Without further ado, I'd like to call upon Lord Tarver, the first speaker, to deliver his speech.
Good morning, ladies and gentlemen, and welcome to today's debate. Today's motion, as we've heard, is GP email consultations will provide positive outcomes for the NHS, and we, as side proposition, strongly agree with this motion. We would like to define email consultations in our model today as an added service from your personal GP, in addition to the face-to-face system currently provided by the NHS. In my speech today, I have 2 main points. First of all, the cost-effectiveness of email consultations, and second of all, the increased efficiency that this system will bring. My second speaker, Lady Aladina, will be talking about the cost-effectiveness of this system and how this will lead to a better doctor-patient relationship. And my third speaker, Madam Chair Muthuswamy, will be summarizing our team's case today. Now, onto my main substantive. You don't have to be an expert in the field to know that the NHS is in severe debt that is increasing year by year. How would you react, ladies and gentlemen, if I told you that face-to-face consultations actually contribute to a significant amount of this debt? How would you react if I told you that by reducing face-to-face consultations down by a mere 10%, we could save the NHS £1 billion a year? Yes, £1 billion. No, thank you. And we believe our system today does exactly that. By introducing this new system, we can help to reduce the pressures of current patient load and create a more efficient primary healthcare. By reducing waiting times, by reducing missed appointments, increasing patient satisfaction, and most importantly, reducing costs. 70% of GP consultations nowadays are due to the flu, the headache, or the following up of a chronic condition. And I pose this question to you. Why waste NHS resources and the time of working individuals when this issue can be resolved by a simple email? Why waste £1 billion a year for a system that is outdated and doomed to fail? Move forward with modern technology for a more sustainable NHS. And for all these reasons, I beg you to oppose. Thank you.
Thank you, Lord Tarver, for that fine speech. Now, Lord Mehmi, the first speaker for the opposition.
Thank you, Honourable Speaker of the House. I'm here to present side opposition of the motion. I will be presenting our points on cost and poor medical practice. Lord Barker will be presenting our points on accessibility and security, and Lady Ho will be summarising side opposition. A system doomed to fail. Let's not repeat history. I would like to begin by rebutting some of the points raised by side proposition. Lord Tarver, you have claimed this new system will save the NHS £1 billion. However, I would like to know where you plucked this 10% figure from to make your £1 billion savings. Secondly, you have not mentioned or considered any of the costs required to set up this new IT system. Costs including software, hardware, training, maintenance, security and encryption. These are a few of the costs you have avoided in your argument.
On a point.
Rejected. If we look at the recent NHS fit, it was estimated to cost £2.3 billion, but the plug was pulled when the final estimated cost was £12.4 billion. That's right, ladies and gentlemen, £12.4 billion. How can you justify spending this much money and taking away from other much-needed resources? The cost of this new system that will be required is a huge factor that you've deliberately failed to mention.
On a point.
Rejected. This is why, ladies and gentlemen, this is a system doomed to fail. Now to my first point. GP email consulting will introduce poor medical practice. Firstly, we will lose a human interface and non-verbal cues, both essential in efficient diagnosis. In a study according to the BMJ, patients value face-to-face consultations, especially when the matters are sensitive or complex. Patients value interpersonal interaction. In addition, this could lead to diagnostic errors with a lack of physical examination, miscommunication of error, and ultimately lead to a demise in patient care. This has a huge potential for liability claims. Secondly, time. You have failed to mention a time frames for response to emails. Patient satisfaction decreases as time to respond increases. This will therefore increase the workload and pressure on already overstretched GPs. So, ladies and gentlemen, for all the reasons I have mentioned, I believe you can now see why GP email consulting is a system doomed to fail.
Yeah, yeah.
Lord Mehmi for that fine speech. Next I call upon Lady Aladina, the second speaker for the proposition.
Thank you, Honourable Chairperson. To begin, I would like to refute a claim that Lord Mehmi has made. You have said that the scheme will result in poor clinical practice due to the loss of physical examination. We say, no way, Jose.
No way, Jose.
There is nothing stopping the GP from requesting the patient to visit for a physical examination.
A point.
Rejected. The doctor's role will progress by adopting this technology, and they will have the time to consider the information and consult with colleagues. Now I would like to present you with a question. Who in this audience relies solely on face-to-face communication within their personal and professional lives?
Me.
I have no doubt that every single one of you will agree that instead, by utilising modern-day technology, you are able to enhance your relationships as well as and improve your accessibility to your friends, colleagues and loved ones. This leads me to my main points of the enhanced doctor-patient relationship as well as improved accessibility to healthcare that this scheme will provide. There is evidence within the BMJ to demonstrate that emails improve the doctor-patient relationship. In a case of patients suffering from anorexia nervosa, they reported that emails increased their sense of being in touch with and looked after by the clinician. This was because emails diffuse age and status barriers and allow a mood of informality in which patients feel comfortable discussing sensitive issues. Imagine trying to remember everything I've just said. Studies have shown that patients forget up to 83% of what their doctors tell them immediately. With emails, all the information is written down and stored and can even be shared with carers or family. Email consultations will certainly improve accessibility to healthcare. 80% of households have the internet and 63% of adults use the internet every day. 67% of adults use the internet every day in Great Britain. Those that will most benefit are individuals with difficulty travelling to the GP, such as the 1.2 million wheelchair users. Imagine the relief email consultations would provide if you were in their position. To conclude, move forward with modern day technology for a more sustainable NHS. Thank you.
Bravo, bravo.
Thank you, Lady Aladina, for that fine speech. I next call upon Lord Barker, the second speaker for the opposition.
Thank you very much for that introduction, Lady Chairperson, and thank you, Lady Aladina, for raising the issue of accessibility. I would first of all like to rebut with a few points regarding access. First of all, GP workload. A system like this is going to result in the inundation of GP practices with a host of trivial medical problems that patients would otherwise not seek medical advice for.
Hear, hear.
This is therefore going to result in the system being impotent. This is because it will raise GP workload and therefore not save time and money of the NHS. Second of all, widening of social disparity. Those that need the system most will not have access to it. This includes lower socioeconomic groups due to the cost of the internet, where 49%...
On a point.
Accepted.
My research has found that the majority of the individuals without the internet claim that they don't want it.
Okay, that's very interesting, but in actual fact, during my own research, I found out that 49% of those without access are from lower socioeconomic groups, and 38% of people not online are unemployed and therefore from lower socioeconomic groups. This therefore invalidates your point. Second of all, the elderly are going to be excluded from this. This is because computer illiteracy is prevalent in the over 65s. Almost a third of over 65s have never used the internet altogether. Now moving on to a new point, security. To start off with, I want to talk about fraudulent misuse. A system like this is going to be open to fraudulent misuse with either the production of false prescriptions or falsifying health information. Additionally, I want to talk about confidentiality and safety of information. A study listed patients' fear of privacy of information being a key barrier to actually using this system. Now I'd like to bring your attention to this list of companies that have been hacked since 2005. Just to pick a few of my favourites, the Pentagon and Bank of America. Also PlayStation, where 77 million accounts of credit card details were lost. All these organisations spend huge amounts of money on the purchase and maintenance of encryption software. And yet they have been unable to prevent these attacks. I hope therefore with this information that I've given you, it's clear that confidentiality, safety of information and fraud prevention cannot be guaranteed to the public. This therefore means the system is doomed to fail.
Thank you, Lord Barker, for that fine speech. I would now like to open up the debate to discussion by the floor.
Bloody, bloody, blah.
Question, answer, finish.
Thank you, audience, for that lively debate. I would now like to call upon Madam Chairman Swami to present the conclusion for the proposition. In conclusion for the proposition, we support the aforementioned email-based consultation system for GPs, as it would reduce the financial burden on the NHS, improve time efficiency, create a better doctor-patient relationship, ameliorate medical practice, and be accessible to the majority of the population. The opposition, Lord Barker, indicated a concern over the security of the system. What we are proposing is a carefully regulated encryption-based system. Any new system is accompanied by risks, and we feel that it would be ridiculous to ignore a system that could bring so much benefit simply due to a potential risk. We are not suggesting an overhaul or a compromise of the current system, but rather just enhancing it by adding an extra service that would provide positive long-term outcomes by using technology that is already easily available and easy to use. Anyway, furthermore, it only seems natural that we, in the healthcare profession, embrace technology that's already revolutionised communication in so many aspects of life. Therefore, I urge you to support this motion and with us move forward with modern technology for a more sustainable NHS. And now the final speaker, Lady Ho, for the opposition.
So in summary, we as side opposition believe that this system is doomed to fail due to the following factors. Firstly, there are many potential barriers to access, including a lack of computer literacy, lack of internet access, and language barriers. However, patients who find the service easily accessible may be inclined to report every minor symptom, which would increase the already strained workload on GPs. Secondly, security and patient confidentiality are huge areas of concern. Security of the system could be compromised by the simple mistake of typing the wrong email address, resulting in sensitive information ending up in the wrong hands. The cost of encryption software, added to the cost of setting up and maintaining a specialized network, would be considerable. Email consultations could also result in inaccurate diagnoses, as GPs aren't able to carry out physical examinations or observe potentially vital non-verbal cues. This could form a basis for liability claims, which would contribute additional cost. Finally, the ethics of introducing a system that could widen social disparities, as well as how the information will be stored and used, should be considered. Thank you for listening, and for the above points mentioned, I strongly urge you to vote against the motion.
Thank you, ladies and gentlemen. That concludes today's debate.
Yay.